everyone, my name is Alyssa, and today we're going to be talking about visual impairments. So, visual impairment is any visual condition that impacts an individual's ability to successfully complete activities of their everyday life. The Centers for Disease and Control Prevention describe it as a visually impaired person's eyesight that cannot be corrected to a normal level. So, there are many types of visual impairments. I'm going to list the ones that I've listed. There is visual acuity, visual field, blindness, photophobia, visual distortion, perceptual difficulties, or any combination of the above features that I just said. Visual acuity is the inability of the person to see objects as clearly as a healthy person. This is normally measured between 20/70 and 2400 with the best possible correction. Visual field is the inability of an individual to see as wide an area as the average person without moving their heads left to right or without turning them in order to see. So basically this is like our peripheral vision. Blindness is defined as a visual acuity worse than 2400 with the best possible correction or a visual field of 10 degrees or less. And just a fun fact, global blindness, not fun, but global blindness rates are expected to soar within decades. Photophobia is the inability to look at light. Visual distortion is the distortion of images. And perceptual difficulties, which just has to do with any difficulties of perception, seeing close, seeing far. And like I said, any of the above features that I just listed combined is also a visual impairment. So there are many causes of visual impairments. Some people are born with it. They could be born blind or with vision loss, and this can be caused by many different things, including abnormalities in the development of the eye or injury to the eye structures from things like infections or STDs from the mother when given birth, or any developmental problems or injury to the parts of the brain that are responsible for vision. Some of the factors placing an infant, toddler, or a child at significant risk for visual impairment include prematurity, low birth weight, needing to be treated with oxygen at birth, which comes along with premature, or bleeding in the brain. Also, family history, infection of the mother during pregnancy, like I stated before, and problems with the central nervous system, such as developmental delay, cerebral palsy, seizures, or hydrocephalus. So there are two types of visual impairments that they kind of called a third-party characteristic. Is congenital or adventitious. Congenital occurs during fetal development at birth or immediately after birth. This visual impairment is present before memory has ever been established. Then the adventitious occurs after having normal vision either through hereditary condition or trauma, and visual memory may remain. Who does visual impairment affect? Although impairment of vision can occur at any point in life, it is more common among the elderly, but like we just stated before, it could happen at birth, during fetal development, or right after birth, or even earlier in life due to trauma or any infections or diseases. Common conditions are genetic or developmental abnormalities, and these children with partial or complete impairment are often developmentally delayed in gross and fine motor skills. Visual impaired adults struggle with gaining employment and completing their day-to-day activities. So now comes the topic of visual impairment in students. So children who have trouble seeing or any visual impairment often, unfortunately, perform poorly at school. Now, this is really because most of learning that is done through vision. So most perform poorly at school because of this. And it is through sight that much of what we learn is received and processed. It is believed that up to 80% of what children without visual impairments learn is through visual cues. The other senses do not fully compensate for the loss of sight. It has been said that touch and hearing can be ineffective substitutes for many individuals. Having a visual impairment can affect learning in social, motor, language, and cognitive developmental areas. And unfortunately, reduced vision also can result the student in having low motivation, which can also affect their academic performance. This is normally because these students cannot share common visual experiences with their sighted peers, and therefore vision loss may negatively impact the developmental social skills. Also, in addition to no motivation, this can also impact their self-esteem and cause the self-esteem to be very, very low. Children with vision problems can find it difficult to write as well, or might have problems with math and other subjects. Schoolwork can be a challenge for a child who cannot keep a clear focus, and students with visual impairments can learn roughly at the same rate as the other students, but require direct interventions to develop understanding relationships between people and objects in their environment. Because they never had sight, or maybe they had sight at an earlier age and remember what that was like, but now are adjusting to not having sight, it takes a lot more interventions, a lot more time, and assistance. It has been said that focusing on the core curriculum isn't enough for these visually impaired students. They need more special instruction in other areas like communicating, social interaction skills, orientation and mobility, independent living skills, leisure skills, use of technology, and self-determination. Next, the modifications in the classroom. This is also a big one and something that will really kind of vary based on the severity of the child that you are dealing with and their severity of their visual impairment. In part of my research, I found that it's generally easy to accommodate a student with visual impairments in your classroom. I didn't really understand how it can be that easy, but it was just saying that it really requires an awareness of the student's level of visual functioning. So as a teacher, you have to be really, really aware of where your student is with their vision. However, there are some basic practices that can be a guide to development of the most effective adaptations. Encouraging the student to move independently through the classroom, organize your classroom accordingly. This includes things like materials, kind of keeping them in the same place at all the time and not moving them around the room, so that once a student that is visually impaired gets used to where that is, they know where that is. And if it happens to move, then that will give them some trouble. Keeping the desk in the same order, the same, like sequence all the time, and just kind of other objects in the classroom that they use daily. Just other safety things, kind of making sure that cabinets are fully closed at all times, chairs are pushed in, doors are not left open or half open. This will just help in the safety of that student navigating within the classroom, and will make them more comfortable in the future too. Also, kind of like I was saying before, to really just know your student and be aware of their visual impairment. For example, if a student just has low vision or has perceptual difficulties, making sure that he is near the front of the room where he can see the blackboard or whatever, the screen, or whatever you are using normally, so that they're in the front of the room and they can see it easier. That's just kind of common sense. For someone with the photophobia that has trouble seeing in light, controlling the lighting, for those students that are sensitive to it, just being aware of that. Also using verbal cues with those students who cannot see body movements or physical cues. So, like I said before, just kind of really being aware of where your specific student is at in their visual impairment. That can really just help the teaching strategy, and over time, I know it'll come easier over time. In the beginning, it doesn't sound too simple, just know where they are in their vision impairment, but over time, learning how they are, observing them, and seeing how they are in the classroom, that can really just help you in the long run. One key accommodation that is absolutely essential is access to textbooks and instructional materials in the appropriate media, and that they're following it at the same time as their sighted peers. For students who are blind, this may mean Braille and or recorded media that they can listen to. For a student with low vision, this may mean large print text or the use of optical devices to access text and or recorded media while in class. So again, just kind of the common sense part. If they can't, if they have low vision, kind of making things bigger or closer to them so that they can see it. Also, working closely with the student's teacher as a school counselor of students with visual impairments in advance helps to ensure the accessible materials for them and help them with getting those materials in a timely manner. Lastly, school counselor's role. So, with the right training and therapy, delays related to visual impairments can be minimized. So as a school counselor, our number one role, always, always, always advocate for the student. So really being aware of the students that are visually impaired and talking to their teachers on a regular basis, checking in on them, talking to them, and just making sure that teacher is following through with the appropriate accommodations in their classroom. Help make modifications to support their learning, kind of like what I just said. Just keep up with the teacher, really talk to them, observe in the classroom, see if you like what the teacher's seeing. If not, maybe meet with them and talk to them afterwards and give them some more tips or resources to help them help their student. Promote awareness to all in the school system, talking to everyone, making everyone aware, educating everyone so that even if that student may not be in their particular class, they will be aware of it, be educated so that maybe they do in the future get a student that is visually impaired, or just if they happen to see that student, how they can help them. Work on appropriate social skills with students to help them interact with peers and teachers. So meeting with those students on a regular basis is probably beneficial to them, and the teachers can't always work on the communication skills or the social skills or how to use technology and some of those things. So as a school counselor, those are the things that we can work on one-on-one with the student that is visually impaired. Teaching personal space or just basic social interaction skills that they do not understand because they have vision issues. And lastly, just give as much assistance as possible. As a school counselor, that's just our main goal. Being there for the student, advocating for the student, giving as much assistance as we possibly can. So yeah, I hope you guys learned a lot about visually impaired students, and I hope that this presentation can help you in the future in your career. Thank you.